Let's talk more about this year's flu season with Dr. Dale Kalina Samji, infectious disease specialist. Thank you for joining me this morning, Doctor.
Thanks for having me, Lauren.
So what should Canadians be looking out for this year when it comes to the flu?
Yeah, so the flu season right now is hitting hard and fast right now. It is fast. It is a lot more than what we would expect at this time of year. And realistically, that's something that we do see in heavier flu years, right? The vaccine that we have, and every year we have a vaccine that is targeted towards what we expect to see. But the reality is the majority of strains that we're seeing in hospitals and in testing right now aren't very well covered by the vaccine. Now, that said, there are multiple strains. So there's a whole bunch of strains that are covered by the vaccine, and that's likely why we're not seeing them in the hospital, for example. But it's gearing up to be a pretty bad flu season, and that's what we're seeing so far.
What advice can you give to Canadians in terms of what exactly they should be avoiding or looking out for, or how they should be taking care of themselves to avoid getting the flu?
Yeah, so a lot of the flu that we're seeing right now is actually in kids, which is not surprising. School is still in session right now. So what people need to remember to do is, especially as we're starting to gather for, holiday parties and kids' concerts and things like that, those are gathering points for a lot of people to transmit disease. So if you're feeling unwell, don't go to that concert. If you're feeling sniffly and cough and that sort of thing, keep your kid home from school. These are all things that we know, and sometimes it's difficult to kind of cross that barrier, as it were, to, we need to keep this kid home, we need to stay home and away from other people. But it is so important to make that distinction so that you can celebrate holidays together if that's your jam. But at the same time, we need to remember that we have all the tools to keep each other and ourselves safe. Vaccines, which really do help a lot of people, especially those around us who are immunocompromised, and also doing things like wearing masks, washing your hands, and staying away from people if you're sick.
How important is it for Canadians to get vaccinated, and how much would the vaccine actually help?
Yeah, so it is so important for Canadians to get vaccinated, both against the flu and also, if you can, against COVID as well. Because at the end of the day, regardless of whether it's a really high efficacy level of the flu vaccine, for example, or a little bit lower, it's always going to help a measurable amount, not only in terms of people feeling a little bit better with if they do get the flu, but also avoiding hospitalization. We know that with this vaccine this year, it isn't looking like the best match for one of the main strains, but that there are multiple strains, and the other two strains that are included in the most common vaccines are fairly well covered. So it is still so important to get vaccinated. It's an easy thing to do to help limit the spread of vaccine, to help our emergency system and also healthcare system in general, and also really to keep people safe around you.
You mentioned that this year we are seeing an influx of cases. Why is this year different? And if you could elaborate on how it is different than we've seen in previous years.
Yeah, on years where we have, it's an H3N2 variant of the flu. And when we do have those variants, we do tend to see a harsher flu season, which is what we're seeing right now as well. And that, coupled with that being the strain that is a little bit mismatched, it seems, in the vaccine, that's, I think, why we're seeing a much higher increase a little bit earlier on. It's very similar to what we saw, I think it was 2 or 3 years ago, that we saw a higher or earlier peak. We don't know where we're going to peak this year, but we are worried, of course, that it is going to be a harsher season, which results in people who get hospitalized. It results in people who die as a result of the flu as well. And that is what we're going to start seeing. And it's a reminder that the flu is not a walk in the park for everybody. There are lots of things that we can do, not only to prevent the flu, but also to treat it. We have medications to treat the flu as well. So if you are feeling unwell, it is important to reach out to your primary care team, get testing done if you can, and get medications to help yourself.
Okay, thank you for those important insights this morning. That is Dr. Dale Kalina Samji, infectious disease specialist.